Hello, my name is Dr. Bryan and I'm here to give you some healthy hints for harmony. Today's topic is carpal tunnel syndrome. Now, carpal tunnel syndrome is part of a larger group of disorders called repetitive stress injuries, and those are things that cost the nation somewhere around $27 billion a year in medical treatment and lost income. Carpal tunnel itself is something that causes more than 2 million visits to the doctor each year, and it affects women about 3 times as often as it does men. It's also one of the most common job-related injuries, and there's around 260,000 carpal tunnel surgeries that are performed each year in the U.S. So the question is, what is carpal tunnel syndrome? Well, first of all, carpal tunnel syndrome is going to be a compression of the median nerve within the carpal tunnel of the wrist. There's a specific area that happens within the wrist that's right in here where a bunch of tendons go through and the nerve goes through as well. And basically, if the tendons get irritated, they swell up and they basically crush the nerve. Now, some of the symptoms of carpal tunnel syndrome include burning, tingling, itching, numbness. You can have a weakened grip strength and the fingers can feel like they're useless and swollen. And you can also have wasting of the muscles right here, basically at the base of the thumb. It's called the thenar eminence. So the question is, how is carpal tunnel syndrome diagnosed? And the first thing is always going to be the history. We ask the questions and try to find out how it started and things like that. The second thing is going to be a thorough examination. And on occasion, depending on the situation, sometimes we'll do some more extensive electrodiagnostic testing. We'll order something called a nerve conduction velocity, and that's something else that can help with the diagnosis of carpal tunnel syndrome. One of the major issues with carpal tunnel syndrome, though, is how it is misdiagnosed. Only 1 out of every 1,000 cases of carpal tunnel syndrome is actually carpal tunnel syndrome. There's a lot of different things that can mimic it, and there's a bunch of different reasons for it. For one reason, patients will commonly say that if they have anything wrong with the wrist or the hand, that it's carpal tunnel syndrome. And unfortunately, when it comes to healthcare providers, it's the same thing. A lot of times that there's a wrist pain or a wrist issue or hand pain, and it's automatically diagnosed as carpal tunnel syndrome, and that's it. And that's not necessarily the case. And of those 260,000 surgeries that we have for carpal tunnel syndrome, where they snip a ligament right here in the hand, there's a high percentage of those that aren't necessary, where people didn't necessarily get the conservative care beforehand, and they just went and got their hand basically cut open. So the question is, what can a chiropractor do in order to help you? Now, the first thing is going to be chiropractic manipulation. You can do manipulation of the wrist and the hand, and that in and of itself, in some cases, can help the problem go away. Other times, there's some situations where manipulation of the neck is something that you can do to help the problem go away. You can always do stretching and strengthening exercises that I would teach a patient here in my office, and you can also do something that's a modality like electric stimulation. One of the things that sets me apart from other healthcare providers in the area is that I'm certified in both kinesiotaping and Graston technique. As a certified kinesiotaping practitioner, I am trained to do different techniques in order to relieve pressure on nerves in things like carpal tunnel syndrome and other kinds of compressing neuropathies. When it comes to Graston technique, I'm the only provider in the Toledo area that's actually certified in Graston technique. And there are multiple different things that you can use Graston technique for, but it does work wonderfully with things like carpal tunnel syndrome. Thank you for listening to my Healthy Hints for Harmony. You can find some more information on the treatments that I use in my practice, like Graston technique and kinesiotaping, on my website and blog. And you can also find more information on how you actually know whether or not you have carpal tunnel, and I'll give you the secret that even a lot of medical doctors don't know. If you go to my website and my blog at www.harmonychiro.com. Thanks a lot for watching.